Hey guys, it's Dr. Rishi Desai here from Osmosis. I'm the Chief Medical Officer, and this week I want to talk to you guys about top 3 do's and don'ts of patient care. First tip, treat a patient the way that you'd want to be treated. Don't preach. And I have a short story I want to share with you. I was with a family member, and my family member is using methadone. Methadone is a way to get off of opiates. And the physician didn't know that I was a doctor. I was just kind of sitting there as like a friend or a family member. And I got to hear how this doctor was speaking to my family member, and I was blown away. It was really disrespectful. It was rude. It was preachy. They're like, "Why are you using methadone? Why are you on that drug? That's for drug addicts, etc." And it was really, really condescending. It was mean. And then I mentioned, "Oh, I'm a pediatrician," and the whole tone changed. Immediately the person was really nice and kind of, kinder and, gentler. But it was really kind of eye-opening. I was like, my gosh, you thought I was a doctor, that's why you're being nice, but up until then you were being kind of condescending to my family member here. And so that was a good lesson for me in terms of how patients are often treated, and that was really upsetting to me. So again, when you have a patient in front of you, treat them the way that you would want to be treated. Again, whatever the issue is, they're coming in very, very vulnerable, and just respect that vulnerability and be kind around it. So that's the first thing I wanted to say. Tip number two, remember to follow up and don't forget those patients. So for example, one thing that I often try to do myself, but I don't see a lot of people doing, is calling my patients maybe 2-3 weeks later just to check in. It takes 5 minutes, and you can literally just say, "Hey, I've got 5 minutes. I'd just like to call and see how you're doing." And that makes a world of difference for your patients, that they know that their doctor called to check in on them for 5 minutes. Keep in mind, I might spend 20 hours, working on a patient across 2 or 3 weeks when they're in the inpatient side in the hospital. That extra last 5 minutes of just a phone call is what will really remember, what they'll remember, what they're going to kind of walk away remembering you by. And so just, if you're going to spend all that time in the hospital caring about a patient, care for those 5 more minutes just a few weeks later, just to say, "Hey, how are things going now that you're home? Is everything okay?" And every once in a while, you'll find out that things are not okay. And you'll be so glad that you called, because then they might come back in for another reason, or there might be an issue that they may not have been thinking about to check in with you on. So it's great to just kind of do that follow-up call a few weeks down the road. Tip number 3, be honest and don't lie. So I have a short story here too. I had a patient who had a bone biopsy. It was a little girl, and she needed a bone biopsy of her upper arm, her humerus. And we got the biopsy results, and it turned out that the biopsy tissue was of muscle. Actually, they didn't even get bone. And so we had to go back and explain to the mom that we needed to get another bone biopsy. This is a painful procedure. It was not comfortable. It was very upsetting for the little girl, as you can imagine, and her mom. And she said, "Well, why?" And I heard my attending say, "Oh, it's because the first one was not conclusive," which is true, technically. Like, it wasn't conclusive. We didn't get an answer from it. But what he didn't say was that actually we didn't even get bone, meaning that the person that did the procedure messed up. And so we talked about it a little bit later, and I went back and spoke to this attending and said, maybe we should just tell her that, we actually just missed the bone completely. It was a mess up on our part. And he was like, "Yeah, I guess we could say that. I mean, I don't see the difference, but if you want to, you can go explain that." And so I did. I told this patient, I said, we in the first biopsy it wasn't inconclusive because the tissue wasn't good. It was that we actually got the wrong part of the arm, and we got the muscle, not the bone. And she took it really well. She was like, "Yeah, I understand, people make mistakes or whatnot. But I'm really glad you told me." And so again, be honest. If there are mistakes, just be straightforward about it. Don't cover it up. Don't lie about it. I think patients really respect that. And I think that her respect for our hospital went up because of that. So again, a few tips: treat a patient the way that you'd want to be treated. Don't preach. Remember to follow up, and don't forget patients a few weeks later. Just give them a quick call. And number 3, be very honest, especially around kind of mistakes that get made, and don't lie about them. Take care, guys. Bye-bye.
Start your free trial today at osmosis.org.